If you have an upcoming surgery, I'd like to give you some practical tips that will increase the probability that you will have a smooth recovery. The plan for a smooth recovery begins weeks prior to the actual surgical date. At your last visit with the surgeon prior to the surgical date, inquire about medications that he or she would like to initiate. Some surgeons like to prescribe a certain multivitamin or zinc and vitamin C to help with incision healing. Inquire about the pain management protocol that he or she recommends. Also, inquire about medications to discontinue prior to surgery and how many days prior to surgery. For example, if the patient is on aspirin or other blood thinners, certain other medications that need to be stopped a certain number of days prior to surgery. Inquire about work and activity restrictions, and if you can drop off the FMLA form that the surgical team will need to fill out so that you can take time off of work. In the United States, you will need a preoperative history and physical performed by your primary care provider. That usually includes certain labs, a possible nose swab for the staph germ colonization, a COVID swab, etc. At the surgical visit, ask your surgeon for a copy of the preoperative form or documentation, and you can physically bring it to the appointment with your primary care provider. Ask the surgeon for a referral or prescription for physical therapy, occupational therapy at that visit, so you can set up post-operative visits before your surgical procedure. Also, line up proper transportation to and from the surgical center. Please don't drive home yourself after a surgical procedure. You don't know how your body is going to react to the anesthesia, and you don't know what level of pain you will be in. It may be very dangerous to drive home alone. Also, speak to somebody, a loved one or a friend, that can reliably pick up groceries for you, run errands such as going to the pharmacy to pick up medications, etc. You will need help, especially post-operatively the first few days, for people to run errands for you. The day of the surgery, please arrive early to the surgical suite. If they tell you to arrive at 8 a.m., try to arrive at 7:30 or 7:45. This will help the surgical team immensely as they walk you through the check-in process. After the procedure, when you are in the post-operative recovery room, if you don't feel well or something feels off, inform the surgical team immediately. They are well trained to look for any signs or symptoms of complications. When you're home post-operatively, try not to miss any formal physical therapy appointments, as this is very important for your recovery. Ask the physical therapist if there are any exercises, if any, that you should be performing every day at home, and the number of repetitions and how often. Stick to your pain management protocol so that you can recover faster. Make sure you're drinking enough fluids and you're taking in enough calories. And follow the activity, work, modifications, restrictions very carefully so that you recover more smoothly. Immobility after surgery can lead to certain complications such as pneumonia. If you develop a fever and you're coughing, inform your team right away. Wound infection. If the surgical site skin seems hot, red, tender, swollen, abnormal amount of discharge, inform them right away. A blood clot in the lungs, otherwise known as a pulmonary embolism. If you develop shortness of breath, etc. A deep venous thrombosis, a blood clot in the legs. If you begin experiencing severe leg pain, the leg is very swollen and painful and red, that may be evidence of a blood clot in the legs. Also, post-operatively, make sure you don't miss your post-operative visit with the surgeon, where he or she will evaluate you and either update your activity, work restrictions, or release you.